everybody. Welcome to our second episode of the Let's Talk Kids Health Facebook Live. I am so excited to be here again with you, but this time with another special guest. This time we have Lauren Daugherty, and she is going to be talking to us about art therapy and children. So I'm going to go ahead and introduce her, and then we'll just get started. So, Lauren is the art-based wellness experiences manager at the Sidney and Lois Eskenazi Museum of Art on the campus of Indiana University, Bloomington. She utilizes looking and talking about works of art in conjunction with more traditional art therapy methods to promote health and wellness, well-being of individuals of all ages. She is a graduate of Heron School of Art and Design's Art Therapy Master's Program and has extensive experience working with children and teens with behavioral health concerns. So, thank you for being here, Lauren. I am looking so forward to talking to you today.
Yeah, thanks so much for having me. I love the chance to talk about art therapy with a captive audience.
Yes.
Yeah.
So perfect. So why don't we go ahead and get started? Because we have several questions, and then I'd like to open it up to folks that are watching this broadcast live. So make sure, viewers, that if you want to have your comment or question be asked, to just authorize StreamYard to show your picture and all of that, and the instructions are there while you're watching. Okay, so let's get started. So the first question is, what is art therapy?
Okay. I was told in grad school to prep a 2-minute elevator pitch. So you'll get a little bit of that today. Art therapy, because it has the word therapy at the end, is a mental health profession at its core. We focus a lot on using the creative process to promote health and well-being. It's for all ages. So there's a really huge misconception in the world of art therapy that it's only for kids, which I know we're talking about art therapy and kids today, but it really is for everybody. Everybody, all ages, all genders, any sort of mental health concern you're dealing with. And I, as an art therapist, am a master's level clinician, which means I have 6 years of training. So I have 4 years of undergrad, 2 years of a master's program. And I'm still working towards my full licensure. But in the state of Indiana, anybody who has that ATR letter after their name is considered an art therapist. So I fall into that category.
And what does ATR stand for?
ATR is the credential for an art therapist. So there are 3 different, if anybody is watching this live and then afterwards you're like, I really want to see an art therapist, anybody who is an ethically practicing art therapist will have ATR after their name. So they'll have either just a plain old ATR, ATR-P, or an ATR-BC. The BC is the highest level, meaning that you're board certified, you've taken all of your exams, all that stuff.
Wow, I didn't know that. Thank you for sharing that information. Yeah, so, obviously this is Let's Talk Kids Health. And so what are the general benefits of art therapy for children?
So many. Art making is really a natural language for kids. So like every parent, I think, gives their kids art supplies. They're in every single preschool classroom. If you walk in a kindergarten classroom, elementary school, art supplies are always there. Art therapy specifically is a really good way for kiddos who maybe have a difficult time processing information verbally, or you don't yet have that vocabulary, to be able to make an image and be able to express something. Art therapy can be a calming tool. It can help kiddos process and regulate emotion. It can also, help them process really traumatic experiences. It can help them learn how to problem solve. There are so many benefits for kiddos.
Thank you, because I think one of the things that I always wondered, and before I met you, was just the right type of person who I could like, or the right type of client to send your way. And you had mentioned that, especially for kids, the pre-verbal and that medium. But you also said that art therapy is not just for kids. So are there other types of conditions that you routinely treat?
Yeah, so my experience is in kiddos with severe behavioral concerns.
Hmm.
But there are a ton of art therapists that, just like a medical professional has a specialty like pediatrics, or, some people are eye doctors, some people are surgeons. Art therapists can also have specialties. So we can really treat anything. You just might want to connect with the right art therapist who is really, I don't know, they really excel at treating your kiddo specific condition or your specific condition if you're going as an adult. But we really can treat anyone and everyone.
Great. I mean, I think when I
Yeah.
was preparing for this, I looked at the literature, and obviously, art therapy is something that's used a lot with cancer patients,
Mhm.
trauma
Yeah.
as well. So there's a whole world out there.
Yeah.
Um, yeah. So, this is a good lead in because when choosing what types of therapy is appropriate, either as a parent or a provider making that referral, how does it differ from play therapy or other types of therapy out there?
Yeah, so art therapy, the biggest difference is that we're actually doing something in session. So in that way, it's kind of similar to play therapy, music therapy, drama therapy, dance and movement therapy. Um, we're making art in session and then we're talking about it. As opposed to if you go to a traditional talk therapist, it's just you and the therapist talking, maybe doing some exercises, stuff like that. Um, but I mean, the biggest difference between art therapy and play therapy, in play therapy, a lot of times they're using toys and things to kind of observe how the child plays, observe the worlds that a child is creating while they're playing, and they're using that to sort of gain information.
Hmm.
As an art therapist, we really place a lot of stock in the images that people are creating. Every one of our clients is an expert on their own image. So instead of asking questions about an image like, oh, that man you drew, he looks pretty scary, I might ask them to explain the figure in their drawing. Or I might just ask them to describe their drawing so that I'm not placing any sort of interpretation of my own onto things that they've drawn. Um, so there are kind of components of play therapy and art therapy and traditional talk therapy, but the biggest difference is that we're making art objects and we're using those to gain our information.
Right. Thank you for that. And I'm going to just show a quick comment from one of our viewers. So Caitlin says, we used art therapy with my older three when my youngest was in and out of the hospital. It was life changing in how they process such a hard time in life.
I love hearing comments like that. Yeah, medical art therapy, those individuals that can work in that setting, they're just lovely. It really does help kids process all of the really scary things that are happening in the hospital. So, yeah, I love hearing that.
Thanks, Caitlin, for that comment. We love getting comments and questions.
Yeah.
So, the next question then, how do you incorporate art making and talking exercises in the museum when working with children? And I'm going to stop you there because before you answer, I do want to draw the fact that you are based out of a museum.
Mhm.
Can you explain that? And how
Yeah.
common is that?
It's not very common. IU thinks we're the first university art museum to have a full-time art therapist on staff. There are a handful, maybe a dozen art therapists that are full-time in other bigger city museums in the US, but it's not as common as you would think. Um, so my role's pretty untraditional when it comes to art therapy. So I encourage people to look and talk about works of art and do the making part that's a little, I don't know, a little more common in art therapy land. So when I'm in the galleries with kiddos, we usually stop at one image. I'll have picked a specific image for us to look at that day, or maybe it's a sculpture or some sort of jewelry piece or something. Um, And then I just start asking questions. A lot of times I like to start off with really simple thinking routines. My absolute favorites are the ones by Project Zero at the Harvard Graduate School for Education. They've come up with a ton of thinking routines that you can use to look and talk about works of art. And the really cool thing about these is that you don't have to be a museum educator. You don't even have to be an educator at all or an art therapist. You can use these as a parent in your own home with artwork that might even just be hanging on your walls. Um, so one of them I like to start with quite often is see, think, wonder. So you just ask, what do you see? What do you think about what you're seeing? And what are you wondering, or what questions do you still have? Um, so I use those to kind of start discussions. And then, like every discussion we have with any child, it branches off in 90 different directions really quickly. And then me as an art therapist, I'm taking in all of this information, and then I'm pinpointing the things that I might want to address more with the kiddo. So then we'll move out of the gallery, we go into the art making studio, and then we'll do what's pretty traditional for art therapists is we make something and we talk about it.
Hmm. And I guess when you're meeting a client for the first time, like again, just asking on behalf of some of the families who might be
Yeah.
interested in this, like what does that process look like? Do you first meet with the parent separately, and then how do you do these sessions, and then do you incorporate parents in it?
Yeah, so I always do the first session, which is like my intake session, with the parents and the kiddo. I
Mm.
think it's really important for me to see family dynamics that you get in that first meeting. It also gives both the parent and the child an opportunity to state what's going on. But from there, I really just work with the child. And for like the first month or so, my preference is to work with the kiddo, really get some rapport built with them, some trust, and then we might bring mom and dad in for a family session. But the whole time this is going on, I'm having phone calls with parents just to kind of check on progress at home, make sure that kids are telling me the truth about the behaviors that are happening at home. But yeah, I try to do a good mix of just meeting with the kiddo and integrating parents.
Hmm. And as working with kids, you have to work with the parents too. So I
Yeah.
love to hear that you sort of integrate all of that and keep them informed
Mm-hmm.
and allow them to also share, what's happening week to
Yeah.
week or from session to session. So, obviously, nobody can overlook the fact that we've been living in a pandemic for a long time. And
Yeah.
I personally have seen an uptick in issues, and it sort of was ebbing and around summer, and then all of a sudden it's peaking again now, with kids just having a hard time, challenges with school. Is school going to go? Is school not going to go? Am I going to get to see my friends? And so my question to you is, how are your therapy sessions the same or different during the pandemic?
Whew. We'll just start with the fact that therapy as, I don't know, just as a profession, talk therapy or any sort of therapy, it really is really reliant on that interaction that you have with the client face to face. I get a lot more information from the nonverbals that kids are giving me, how they're interacting and using art supplies than I do with the actual image they've created. And that's something that I am not able to see on Zoom. Um, so, what you're seeing of my face right now is what I see when I look at a kid. So they might be, using their art material on their paper, and I can see the top of their pen. Or I can see kind of their hand sometimes moving and making something. But it's really difficult for me to kind of get that same interaction I would normally.
Hmm.
Um, it's just an interesting thing. I had a kiddo shut the Zoom screen on me a couple weeks ago, which is something that we could not have done um, had I been in person.
Right.
So it has changed a bit. They also have to hold up their image to the screen, and we have to like do some of this and figure out how much of it I can see. The camera doesn't really capture everything. So it's really quite difficult to do art therapy virtually, but we're making it work. Had some huge success with some of the kiddos that I'm working with right now. And thankfully, they're really resilient. So
Mhm.
they're pretty moldable, pretty adaptable. And so we've actually had quite a good time doing it virtually. Yeah.
Yeah, that's good because given the pandemic, mental health needs are super high, and I'm so
Yeah.
glad that you're able to still share your gifts with the families that you're serving.
Yeah.
Yeah. So before we open it up to other folks' questions, comments, I do have one last question. And so, what are some helpful tips for parents to utilize at home when using art to promote emotion regulation?
Oh, this is such a rich question. So little time. Um,
I can see
I
you're getting
do.
excited.
I know. I really like this. So a lot of art therapists that I've met really kind of keep all of this information really tightly knit, tightly close to them, and don't really want to share it. By me sharing some of this information, it's not going to make any parent or any educator an art therapist. I know that, you know that. So I'm always happy to kind of share some tips and tricks with parents. Um, my first my first tip when we're talking about emotion regulation is be mindful of the size of the project or paper you are giving your kiddo. So a lot of times we think big emotion, right? We're feeling a lot of sadness, we're feeling a lot of anger or frustration, and that means we need a really big piece of paper. We need to just let them color on the wall because this kid's got enough emotion to fill an entire wall with mark. Um, but that's not really the case. Kids need structure and they need something to contain that emotion. So we need a smaller piece of paper for them to be able to draw on, or we need to give them a smaller amount of an art supply, like a clay or a kinetic sand, to really contain that emotion. If it's too small, they don't have enough room to express themselves, but if it's too large, it becomes really, really overwhelming.
Hmm.
Yeah. So that's my first my first tip for parents. And it's one that you probably wouldn't think of. I usually say like this is about like 8.5 by 11. I would say this is usually like a good paper size. They're pretty comfortable with that because all of your worksheets from school come on 8.5 by 11 paper. It's pretty comfortable for people. Um, Two, I would say keep in mind the type of art material you're giving someone. So if we're talking about a kiddo who is, level 10 escalated or dysregulated, you do not want to give them something really fluid like a paint or a really wet clay like you would find in an art classroom. Those things are really hard to control. And just like the bigger paper can be really overwhelming and can contribute to that, dysregulation or that emotion a little bit more, which is exactly the opposite of the goal we're trying to achieve by giving someone an art material to kind of regulate themselves. So things that are really good for kiddos who need to kind of release some tension from their body. We're talking about things like model magic. If you don't know that art material, please go get some. It's phenomenal. It's my favorite art material to use with kiddos. You can color it, so it comes white. It also comes in colors, but I prefer the white because you can give kids marker and they can actually make their own color.
Hmm.
So model magic, kinetic sand, um, those things are really good for kiddos who need additional sensory input. Um, Tools or art materials that also might be helpful for kiddos who are dysregulated would be ones they're really comfortable with. So those ones they're using in school, like markers, crayons, colored pencils, again, they have mastery over that. It's like the paper size. It's comfortable, it's familiar. So we're going to see more success with those materials. And lastly, this is kind of a budget friendly tip for all of you parents. Don't forget about those weird things that you have lying around your house, like those Amazon boxes, all of the packing material that's in Amazon boxes, coffee filters, tin foil. All of those things can also be used as art materials. So we don't have to think of art as like a, capital A can only be painting and chalk pastels. It really can be anything.
Wow. I mean, so, I love those three tips. I mean, just the way in which you suggest even the size of the material and matching the medium or the type of um, supply you give them, thinking about that and how dysregulated they are and where you want to work towards. And then, giving them something that they're can master in that short period of time too.
Mhm.
I mean, I guess that was the question that I had. I mean, and thank you for kind of pointing that out. Is how how much do you include like their own preference for a certain, like if they like pastels or if they want to just do marker or whatever, and then you bringing in a different type of supply or medium.
Yeah, so usually in that first session that I meet with a kiddo by themselves, we use whatever material they would like to use, right? Because it
Hmm.
shows me, one, what they're really interested in, but it also builds rapport. It also tells me what level of functioning they're in. So typically, the more fluid the art material you use, like paint or like a wet clay, you tend to express yourself pretty fluently in emotion land, right? So you're like really in tune with your emotions. You want to express those. But if you pick a material like a pencil
Hmm.
that can easily be erased, that tells me a little bit of a little bit about you too. That maybe you're a little nervous to make some art, and you want the ability to redo or undo something. So I'll try to kind of push people in a specific direction. If we've been working with markers for 7 weeks, I might try to push a different art material and just see how they respond.
Hmm.
Yeah.
Do you have any tips for parents? Like, let's say their child is, doing art at home.
Mhm.
Do you have like a suggested prompt for parents to just start that conversation with their child?
Yeah, I think emotions are where we need to be starting as parents. um, so a lot of times kids are afraid to express themselves and their emotions because they, are afraid how mom or dad is going to react.
Hmm.
They're not really comfortable with feeling that emotion, so they don't want to talk about it. But even just asking your child to draw what, anger feels like in their body, or drawing where they feel angry, things like that can really get those conversations started. And it's a pretty, I don't know, it's a pretty abstract directive, so your kids can take it in like a lot of different ways, and it works for a lot of different ages.
Hmm. Do you often, let parents know that they should do art alongside their child or no? Uh,
So it depends. It really depends. So if your kiddo is younger, like we're not in that teenage stage yet,
uh-huh.
I would say you absolutely can make art next to your child. Sometimes we even do attachment building exercises where I make all the parents hold the art materials and make kids ask for a material. The parent then provides that. And it just kind of mimics that sense of what a parent should be doing, is providing for their child and providing that sense of safety. So we can do things like that, where we do parallel drawings. But as we kind of move into the teen years, when teenagers become really self-conscious of what they're drawing, I kind of tend to, I don't even make art in session with teens quite often. They start copying what I'm making if they can see it, or in a group, they start copying each other. And then we're not really getting their authentic response.
Hmm. Yeah, yeah, I can see that too. And
Yeah.
you mentioned like in group. I mean, are there scenarios in which you would do art therapy in a group? I mean, even if it's not for kids, but for other clients?
Yeah. So you actually can do art therapy in groups for kids too.
Uh-huh.
I just, before COVID hit, we were doing a group for kiddos that had CASAs, so the court appointed special advocates through DCS. We were doing a group of 6 or 7 kiddos came to the museum. So we work in groups a lot. I try to kind of group kiddos based on similar experience. So maybe we're doing a group for anxiety or a group for depression, as opposed to just a general mental health group. And then we get, a little bit of everything. Um, But yeah, I'm actually trained. My internship experience all through grad school was in groups, and I actually prefer doing art therapy in groups. I think people learn a lot more from each other, and it feels less like I'm talking at someone, or I don't know, just having that one-on-one relationship. I think groups are so much more powerful, especially for teens, but they also can be pretty helpful for kids too.
Yeah. Do you have an idea of how many art therapists there are just in general?
I don't. It's a really hard. I will say it's up and coming in the Midwest.
Uh-huh.
So there tend to be a lot of art therapists really kind of centralized in the big cities, like in Indianapolis. And then as we get farther out into the rural areas in Indiana, we're kind of less frequent. Indiana probably, no one quote me on this, sorry, like 250, 300 art therapists maybe, and that number might be a little high. So the art therapy program that I graduated from has only been around for like 7 or 8 years and has only generated about 10 per year. Most of us tend to stay here in Indiana, but we might be looking at closer to like 150 or 200 in Indiana.
Uh-huh. Yeah, and remember looking for that ATR behind your name.
Yes.
Right. Yes. Yes.
I mean, and that's just because we don't have a license currently in
Okay.
Indiana. We're pushing right now. It's actually potentially going to state legislature in about 2 weeks for us to get our own art therapy license. But right now, it's not illegal for someone to say they are doing art therapy without those letters behind their name, but it's highly unethical. And you're not actually getting a real art therapist unless they have those fancy 3 letters behind their name.
Yeah.
Yeah.
So we had a comment here again from Caitlin. She just wanted to say that your passion is contagious. So
Oh, thanks, Caitlin. That's such a lovely comment.
I know. So let me just say to all of you who are watching right now, if you do have a question, don't forget you can drop a question right now and I can share it with Lauren. But in the meantime, I'm going to go ahead and show a couple upcoming events that maybe Lauren will want to kind of give a little bit more information on. So this first one is the monthly open studio.
Yeah, so before we were in COVID world, we had a weekly open studio at the museum, and it was buzzing the whole 3 hours we had it open. And that's just a place where people would come and just make things. There wasn't really a therapeutic component, but I was there in case somebody wanted to talk. So now we've switched virtually. We're doing it once a month just because I feel like everybody is really tired of screens. It'll be about an hour. I'll be there leading an activity, but you're also welcome to bring whatever project you're working on at home, and you can ignore everything that I'm saying. Yeah.
Again, promoting that sense of community, which I think is absolutely critical, especially now with the
Yeah.
pandemic, social distancing measures. So that's really wonderful. And anybody can just show up and they have
Yep.
to register for the Zoom link, apparently, usually, but
Yeah.
other than that, they just can show up.
Yep, any and all ages. When we were in person, one of my favorite open studio days, we had a 3-year-old with her mom, and we had an 84-year-old woman in the studio. And everybody was just kind of buzzing around and talking to people they would not have ever interacted with had that space not been open for them. So that was just really cool to see.
Oh. And then the next one is this virtual teen look club. Can you tell folks a little bit more about that and what that's like?
Sure. This is actually not one of my programs, so it's not an art therapy program, but my colleague Kelly Jordan, who's our pre-K through 12 experiences manager, is putting together like an art-ish club for teens. You also have to register for that, and you'll get a Zoom link, but it's just a monthly hangout for teens who are interested in art. I believe sometimes there might be some art making. There's going to be some of those looking and talking exercises, probably some of them from Project Zero, like what I shared earlier, because Kelly's a huge fan of those too. But Kelly's absolutely great, and anybody who joins, you're just going to have a wonderful time.
Oh, that's great. And I happen to see that when you go to the Eskenazi Museum website, it says that the first 12 people who RSVP get a free sketchbook. So
Yeah,
Don't
so get
delay.
on it, people. Get
I
on it.
know. I know. Well, thank you so much. So do you have any other like thoughts as we kind of wrap up? I really have enjoyed just getting to chat with you again and just share these pearls because I think, again, like I said, I think sometimes when I have found that kids are just reluctant in general to engage in any therapy, sometimes they'll just shut down. And I will talk with the family about trying to find, well, what are their strengths? What do they love? What are their passions? And when I hear art, I immediately now think of you. so, um,
Yeah,
yeah, and I think it's like that first open window to and the positive experience for some of these kids who otherwise may not want to do it
yeah,
because it sort of brings them in through what they love and what they know. It just feels more
yeah.
comfortable to them.
That's always always the best place to start. If your kiddo likes horses, you better be going to do some equine therapy.
Yep.
You're just going to get way more buy-in.
Yep.
One thing I will say before we go, anybody who's on the call, if you do visit the Art Museum website, my email is on there. If you're interested in finding an art therapist that's near Indianapolis, let me know and I'll just give you a quick call or we can chat via email, maybe about general concerns you're having for your kiddo. And then I have access to our lovely Indiana Art Therapy Facebook page and can put some feelers out and see if I can get you connected with somebody who's pretty close and who might be a good fit for your kiddo.
Oh, that's so nice. Thank you for
Yeah,
offering that because I know I'm hopeful that after watching this, and if families are like, wow, I've got to look into that. Thank you for that because sometimes it's hard to navigate all those things.
it is. Yeah.
So yeah. So again, thank you, Lauren, so much. I'm going to just do a shout out for next week's show. So next week, my special guest will be Dr. Shelley Flace, who will be talking with me about raising twins, survive and thrive. So and she is an author of a book that was published by the American Academy of Pediatrics. So I'm looking forward to that. And that is actually not going to be an evening show, so be on the lookout. I'll be scheduling that live here shortly. So thank you so much. I just want to make sure we're not missing any questions here. But I think that's it for now. And thank you, Lauren, again, so very much for spending your time with us.
Absolutely. This was wonderful.
Thanks.